Hi everyone, I'm Mae McCarmel, Tiger Lily Foundation's president founder, and a 20-year breast cancer survivor, thriver, warrior, and unicorn. I turned 20 years cancer-free last week, but I almost didn't get to be here because of policy and things that were impacting me as a woman who was younger and of color, which is why policy matters to all of us. And it's important to know what the policies are, why they matter, and how to use your voice for change. This program, 340B, was designed to help patients get support during treatment, but now it works against them for many reasons, which we'll learn why today. So please listen, learn, be educated, empowered, and use your voice for change.
Thank you
Melody?
so much, Mayma. Thank you for sharing and congratulations on 20 years. Hello.
Thank God.
Yes, yes. Hello, everyone. Good afternoon. My name is Melody Rain. I'm the president and founder of Color of Gastrointestinal Illnesses, also known as Koji. I started Koji after my own journey with Crohn's disease and years of delayed diagnosis and barriers to care. What began as a small Facebook community in 2019 has grown into a national organization focused on advancing health equity and improving access to care for people living with digestive diseases. Today, as Mayma mentioned, we're going to be talking about the 340B drug pricing program, a program designed originally to help safety net providers stretch resources so they can continue serving patients who are uninsured, underinsured, or living with complex chronic illnesses. At Koji, we believe patients deserve not only access to care, but also knowledge to understand the systems that impact it. That's why we're hosting this conversation in collaboration with Tiger Lily Foundation to help patients and community organizations learn how to review their medical bills, understand how programs like 340B may show up in their care, and feel empowered to advocate for the access they absolutely deserve. So, we are going to move forward and share with you what you should be taking from today's conversation.
And Lizzie, back to you.
Hi, everyone, and thanks again for joining us. I am Lizzie Wittig from Tiger Lily Foundation. I am the Vice President of our HEAL Policy Center of Excellence, and we'll actually be starting today with, and thank you first to Mima and Melody for wonderful introductions and really focusing this for us on the patient first and making sure that we're keeping that centricity for our discussion today. And the purpose of our webinar today is to increase awareness and understanding of the 340B program, so that educational piece that Mel just spoke so eloquently about, highlighting its critical role in advancing health equity for all of the patients that we serve, and centering that lived experience by patients and elevate community leadership. And then lastly, also to acknowledge the acknowledgement of underserved communities and the leaders who serve them. So we'll go ahead and get started, and I will pass this off to Dominique to introduce herself.
Hello, everyone. I am Dominique Daniels. I am Manager of Community and Patient Support for Koji. Thank you all for being here today. What is the 340B program? The 340B program was created in 1992 as a federal safety net program. It requires drug manufacturers to sell outpatient medications at a discount to certain hospitals, clinics, and contract pharmacies, covered entities, so to speak, that serve high numbers of low income, uninsured, and vulnerable patients. Next slide, Leslie.
Thanks. So the purpose of the 340B program, essentially, as Dominique just mentioned, is to help those dollars serve more patients. And so that is the purpose, though. The cost savings for these covered entities in the program are supposed to go back to patients either through charity care or providing patient services, support, even things like free screening programs. And so what we're seeing, unfortunately, is because this law that created the 340B program is clear in its intent, but vague in its language. There have been some misuses, and we would even say abuses of the program that we would like to highlight today. And first, make it very clear that we think the 340B program is a much needed, wonderful program. And when it works well, it's wonderful for patients. It provides opportunities to access life-saving treatments that vulnerable patients wouldn't otherwise be able to access. However, we're going to be going over some of those misuses today. So one of them here you'll see up on the screen is with hospitals diverting that patient care. And so as you can see, and Dominique just referred to, there are hospitals that become covered entities for the 340 program because they serve these vulnerable populations either through Medicaid patients or rural areas. There's a couple different eligibility requirements. But what we're seeing now is that some of these large hospital systems that become 340B hospitals are buying smaller community health clinics and that serve those communities that encapsulate those populations, which then forces patient care back towards those large hospital systems and more expensive care. So they're essentially being able to make money from buying those drugs at a discount, but then selling them back at the higher costs at the larger hospitals. And so by doing so, they're diverting those funds directly away from the communities and patients that they were meant for, and also diverting that patient care away and causing those patients in those communities to then have to travel to be able to access these drugs and care and at higher costs. So then we also want to talk about the middlemen in here. So a lot of times when we talk about drug costs and insurance and hospitals or pharmacies, we think that those are the only players. However, there are more people with their hands in the system, so to speak. And some of these middlemen, the largest group are called pharmacy benefit managers or PBMs is how we'll be referring to them. But these are essentially for-profit companies that manage prescription drug benefits for patients and insurance plans. So they're essentially the ones deciding how much the patient is going to have to pay for their drug. They also decide what medications are covered, and then they negotiate those prices with the manufacturers and work with the pharmacies to process them. And so a couple things to highlight here. When we're talking about contract pharmacies within the 340B program, those are the pharmacies that are a part of the program and can purchase the drugs at those steep discounts. They can be anywhere from 20 to 90% of a discount in what they're purchasing. In 2010, there was a large expansion of contract pharmacies within the 340B program, like astronomical. You can see there 2,400% is the rate that the contract pharmacy group grew. And that was because the regulation changed that there could be an unlimited number of contract pharmacies, which made sense maybe at the time because not every hospital system or community center or clinic especially had a pharmacy within their own facility, and so they had to contract out. However, that's grown exponentially more than the program intended, and it's caused some issues here. As you can see, almost 70% of all of those contract pharmacies within the program are associated with a PBM. And they all fall within 4 of the largest pharmacy chains in the US. So these are not just, we're talking mom and pops or community pharmacies. These are almost all large chain pharmacies within this program. So then these middlemen use the 340B savings as a profit instead of reinvesting it in that care that's supposed to be happening for patients, again, through charity care, lower drug prices, and patient support services. And not only are they using it as a profit, but they're making more money off of it. So what we're seeing is those 340B contract pharmacies are buying the drugs at the discount and then selling them at higher prices in more affluent and wealthy areas where they can make a larger profit. And so the difference between what they bought the drug for and the full price that they're selling it for, or that they charge to the insurance for, is going in as profit, again, instead of being reinvested for patient care. And so this is what it really comes down to. The vulnerable patients that are supposed to be benefiting from this program aren't then in these cases. And only 23% of those contract pharmacies are in the underserved areas that 340B is meant to serve. And in most states, actually, it's between about 20 and up to 50% of all the contract pharmacies in that state are actually located outside of the state. And we're not even talking just about neighboring states. We're talking about in situations like New York, where there are contract pharmacies as far as California and even Hawaii. There's no patient benefit to state dollars from the 340B program going outside of the state. The patients in that state are not benefiting from that in any way. And so this is another avenue that some of this misuse of the program is being used as profit versus supporting the patients as intended. And I'll pass it back over to Dominique.
Thanks, Lizzie. So how do PBMs profit from 340B? PBMs divert funds intended to support patient access to care to boost their own profits. 340B savings, where are they really going? So here's a breakdown of how it starts. So a pharmaceutical manufacturer sells a treatment at the 340B discount to a covered entity. The covered entity dispenses the medicine through a contract pharmacy. Then the PBM-owned contract pharmacy provides medicine to a patient, bills the insurer at a standard reimbursement rate, and receives a fee from the covered entity. The insurer or the patient, pays for the prescription, with the PBM making money from the difference between the full price and the 340B discounted cost. Many patients still pay their regular copay and don't know that they are receiving treatments purchased at a 340B discount. Next slide, Lizzie. So continuing on of following the 340B and how it's profiting over patients, and patients aren't at the center. The manufacturer sells the medicine at the discounted rate. The drug is administered or dispensed by the covered entity or pharmacy it contracts with. The covered entity bills the payer, the insurance, etc., at the normal commercial or Medicare reimbursement rates, often much higher than the 340B purchase price. I'll repeat that, often much higher than the 340B purchase price. The middlemen, such as PBMs, negotiate rebates and formulary placement with manufacturers. Then the covered entity may use savings for their own benefit, operations, expansion, executive pay, rather than increased access to patient care. So what it should be used for is the intended result is the covered entity can use the savings to make medicines more affordable, support care for patients, and keep essential health services available. We know that doesn't always happen, right? That's why we're here today. So for contract pharmacies, they dispense the drug and may receive dispensing fees or service payments. Again, money out of the savings that should go to patients. Money out for the covered entity or its patient system. It retains the spread difference in reimbursement and 340B price rather than passing it directly to the patient. Again, not benefiting the patient. The patient isn't at the center, it's profits. The PBM owned pharmacy prioritize well-insured patient populations to capture greater profits. PBM negotiated rebates don't lower patients' out-of-pocket costs. Again, following the money. The covered entity captures 340B savings for their own uses instead of using funds to support patients through lower drug costs or expanded charity care. The bottom line is 340B savings intended to support patients' care are captured and siphoned out of the program by hospitals, clinics, contract pharmacies, PBMs, and payers as profit.
Thanks, Dominique. So, as we kind of have gone over quickly here, And we have this kind of goal of the program and the reality of what's happening right now. And again, the goal is that those savings from this 340B program are supposed to be used to help the patients, the most vulnerable patients, those living in rural areas that are underserved, unserved, underinsured, uninsured. Um, every everybody in these communities by lowering the out-of-pocket costs for those patients to access the drugs that they need to stay alive and to live healthy lives, by funding support services. We talked about some of that, like charity care, or other programs, and expanding care for those most vulnerable patients. However, the reality is, as we just shared quickly, that promise has been broken. That's not what's always happening. And there are entities, of course, that are using this program correctly and doing this right and investing the care back into patients the way it's supposed to be, or using it to stay open in rural areas, or, with community pharmacies or community clinics that wouldn't be able to stay open otherwise. And then those communities then would not have access to the services that they provide. But the reality is, in a lot of cases, those savings aren't making it to the patient's pocket or to the care to support them that the program was intended to provide. I'm handing it back to you, Dominique.
So the 340B legislation, the current landscape, state of play. In 2025, 28 states introduced 340B contract pharmacy legislation. Some of the key states in 2025 contract pharmacy legislation was introduced but did not pass in 5 states: Idaho, Illinois, Kentucky, Florida, and New Hampshire. Federal reform is vital. Piecemeal state policies will allow for expansion of 340B policies, enabling more profiteering within the program and failing to ensure the 340B savings are spent to increase access to care for patients as intended.
And before we move on to the next slide, I wanted to just add here. So the 340B program is a federal law that established this program, but each state runs it. And that's why we're talking about specific states and at the federal level. So for there to be reform for the program as a whole, we need that at the federal level. But in the meantime, each state has been, most states have been proposing and introducing legislation specific to that state, that would actually establish laws that would protect this misuse of the program by either saying that the contract pharmacies can't be limited, or no one can tell them that they have to do certain things with the funds, things like that. And so this really is to highlight the kind of dual approach we're having at Advocacy for this, but also to highlight that it's very important that advocacy organizations are engaging in this because it is moving and there is so much happening. And also to share that there has been success, and it's a proven method that when we engage and we share patient stories, the patient perspective, and our advocacy efforts, we've been able to stop that in several states, and it continues this year and is part of the reason we feel this is so important and are having this webinar today. And I'll hand it back to you, Dominique. Thank you.
Why does 340B matter to our communities? For our patient populations who often face systemic barriers to care and significant financial toxicity from treatment, a fully functional and faithful 340B program is not just a policy issue, it's a lifeline to the many patients who have received life-changing diagnosis.
And so, as Dominique just said, when we're talking about why the 340B advocacy is vital, it's pretty clear, we need to protect access to care for patients. So we need to help ensure that these clinics and hospitals that I mentioned, smaller ones in the community, can continue offering affordable medications and essential services to patients who need them most. And then we also need to keep costs from being a barrier for patients. So our advocacy works to protect these programs that help reduce financial strain for individuals and families. When the program's not being used in the way it was intended, that isn't happening for patients. And we know all too well how detrimental medical debt can be. It's one of the top reasons for bankruptcy in the US. This is a huge barrier and issue for patients. And we really need to make sure that we're amplifying the patient voice in all of this work. We want to ensure that real patient experiences are shaping not only new policies, but policies like this that we already have, and making sure that they're working as intended and benefiting patients. And that these decisions that impact access and affordability and health outcomes for patients take into account the real world experience of the patients that it's supposed to be serving. I'll hand to introduce DeAndre.
I am introducing DeAndre Hardy. She is one of our amazing Koji ambassadors. Thank you, DeAndre, for coming on and supporting such a great cause.
Hello, thank you all for having me. I'm here as a Koji ambassador, and I am a Crohn's and colitis patient of 25 years and also a permanent ostomate. So I've been navigating chronic illness for most of my life. And when learning about this program through Koji, I was very enlightened about just the different pieces that go into policy and how they affect our patient experience. I continue, correct? How
Yes.
they affect our patient experience. And for me, I learned about this opportunity through a Color of Gastrointestinal Learning opportunity. And with the 340B program, I've experienced it myself by um, being in a patient who has had insurance coverage, and then my insurance coverage has lapped over time. And during those times, I've had to rely on patient assistance programs and charity programs with hospitals and pharmacy providers, and also learning about how it has impacted my state and patients in my state by increasing costs. So that's who I am and what I'm sharing, coming on here to share about during this time.
Thank you, DeAndre.
Yes.
Lizzie, did you want to introduce?
Yeah, thank you so much, Deandra. Yes. And next up, I would like to introduce Karina Ross. She is an advocate extraordinaire, and I'll let you do your intro, Karina, but just want to thank you again so much for being here and being open to share your story with us on this important issue. And we just appreciate you so much.
Absolutely. Thank you. Hello, everyone. Thank you to everyone that's a part of this wonderful webinar and getting everyone together to help us tell our stories and help us to educate the community of which we are a part of. I am Garina. I am a Tiger Lily advocate. Joined Tiger Lily in 2024 through just browsing my emails. I signed up just to get some news alerts from Tiger Lily and became interested in being a advocate for the 340B program here in the state of Michigan. I was not familiar with the 340B program. But after joining Tiger Lily, I began to do my own research as a 6-year breast cancer survivor. I was diagnosed with inflammatory breast cancer, stage 3 inflammatory breast cancer at the age of 36, which was in 2019. And when I received my diagnosis, I had a career, was just starting my career with a great company that I'm with, wonderful insurance. So I did not qualify for any type of assistance or anything, but at the same time, medical bills continued to mount because I had to go through chemotherapy, double mastectomy, radiation, and my copays, like I would, every time I went to the doctor, I was paying a $50 to $75 copay to the point to where it just began to consume me. It was just too much on top of trying to go through treatment, pay medical bills, still work through my entire treatment plan because, I was single, I had my daughter at the time. She was 16 in high school, so I was still raising her and just making sure everything in my house was still functioning as normal. So I did not reap the benefits of any type of patient care assistance or anything. And getting my treatment from after learning, signing up to become an advocate for the 340B program, I learned that the hospital that I did receive my treatment from and still currently is a 340B hospital, and my prescriptions were not at a lower amount or anything. I pay full cost for my prescriptions, which leads me to even today, after learning from I started a new chemo drug last year in April, and went from April until October of last year. My chemo medication copay was $0. And then from October until December of last year, my chemo drug copay went up to $12,500. How I'm supposed to afford that, I have no clue. And I started rationing out my chemo medication because I'm like, I don't know when would be the next time I would be able to get this drug. And still not receiving any type of assistance, but I did, however, receive a copay assistance card. But the amount that was loaded onto the card was only for approximately like 20 some $1,000. And if my copay per prescription is $12,500, that's only 2 bottles of medication that I will be able to. I don't know. I have to take these glasses off because they are shifting and I'm like, I couldn't get them right. But, I only could afford, 2 bottles of medication at the time. So that's a strain in itself on me, and because I have to keep my mental health, intact. So I don't worry about it. I just let things work themselves out, and whatever is going to be is going to be. And so I talked to my oncologist and informed her that this is like we're gonna have to switch to medicine, So finding out about the 340B program and how it is supposed to work, and becoming an advocate for it, meeting with my legislators here in the state of Michigan, um, reading about the bill that was just that has been introduced to our legislators here in Michigan. It's the 4878 bill, and that bill is introduced to help protect the hospital's ability to use contract pharmacies and the arrangements under the 340B program. And so I advocate because I want to be able to take information back to my community, and educate people that who are low income and who this program can really benefit, and who choose not to even um, go through treatment plans because they feel that they cannot afford the medication. And I help them understand, like, if you can take medication or go through your treatments and it will save your life, I truly recommend you to find out resources, talk to your social worker at these hospitals, talk to them about the 340B program. Again, a lot of people do not know, and a lot of people are unaware and uneducated about all the resources that are available to those that are low income. Even though I have not benefited from being a low income patient, but I still advocate for myself. I still ask them about the 340B program. I still ask them about other resources that could be made available to me. So I use this information to educate everyone and to help everyone become more aware of the things and resources that can benefit them. So I became a Tiger Lily advocate. I am so thankful for the opportunity to be a part of this amazing foundation and the doors and opportunities that continue to open for me.
Thank you so much, Karina. You just have such a powerful story, and again, thank you for sharing it. I wanted to ask you one more question. Actually, you mentioned, I don't know if you mentioned it specifically, but you went to a 340B hospital where you did not receive any charity care or help, and then you got your drug from a 340B pharmacy, and now are having to pay $12,000 a month to get it, knowing that it's a 340B pharmacy. What was your reaction as a patient who now knows about the 340B program the second time around to learning that?
Going back to the pharmacy, the 340B pharmacy, and asking them about how much did they pay for this drug and why are they charging $12,500? And I continuously get these emails, them wanting me to refill my prescription. Of course, you would like for me to refill my prescription. You're getting $12,000 every month for me to refill this prescription drug that probably only costs approximately probably $3, and then here I am having to pay $12,500. I've been with the same company for 10 years. I've had the same insurance. Nothing has changed. So to go from paying $0 to $12,500 as a patient and still trying to work and maintain a household, it is and then on top of that, I'll be a grandmother in a few months, so I have to save my money for my granddaughter. I can't just be giving out $12,500. So I have to try to figure out ways to either eliminate this copay, or not just eliminate it, but to bring it down, because $12,000, that is a lot of money. So I am the biggest advocate for myself, not just for myself, but for people that I know. I talk to them about all types of things, and they say I'm just I'm a walking book, because I like to do research, and I like to help anybody. I don't care who you are. Woman, man, child, anybody. I just love helping people. And especially if I can help you save money, if I can help you get the resources and the things that you need that will be beneficial to the betterment of your life.
Thank you so much. You're amazing. We appreciate you again. And I want to go back to for a second. DeAndre, I know you've had some um, reactions and experiences similar, so we'll hand it back to you to share.
Yes, thank you, Garina, for sharing your story. And, just I'm in awe of you and rooting for you in your journey. Some of the things you said that have really resonated with me was when my lapse in insurance, changing from college over to the professional world, that was a piece where I was considered low income and I did get the charity. But one of the things you talked about is when you're not considered low income, still asking for charity because of the cost of prescriptions and then the way this program is mismanaged. Still, the average person who is working cannot afford the medication, or they still have to make decisions. I remember making decisions like, okay, it's either get my medicine or go to my doctor's appointment, because both copays are high and I can't do both, but they were both major things that could impact my care, and not being aware or educated about even saying 340B. So as someone who was a decent earner, I still was like, I need to go talk to somebody, because I would get this bill and I'm like, I need to see, as they say, I need to see the lady. Like, I need to go talk to somebody about this. So I ended up talking to my social worker about it. But I don't think oftentimes people in our communities are educated to use the right terminology to get the help, are understanding what these bills and policies mean, on top of navigating a chronic illness that you're just trying to figure out how you're going to make it to the next day. Did your doctor really understand what you're going through? Is this next medication going to work? And so programs like Color of Gastrointestinal Illnesses, Tiger Lily Foundation, giving us language has been able to help us navigate our health, but also isn't just another seed in the community that helps spread the education. And I think I live in North Carolina. I've gotten the majority of my care since I've moved here in North Carolina. And even finding out that there were cancer patients in many of our 340B hospitals who were charged, and a lot of the profits, 84% profit on top of the regular profit because of that increase in the prices is outraging for me. So there's still more work to be done, but starting with the education and being able to name it changes the atmosphere and changes even how I like walk into the hospital. Just knowing that I have the right language to advocate helps me be able to feel more in control.
So you're muted if you're talking.
Of course I am. Rookie mistake. Sorry. Thank you both, Karina and DeAndre. You both amazing. We appreciate you sharing your story so much. And it brings us to the focus, right? Like why does this matter? And you both are the reasons, the patients, other patients like you. And like you both said, most people, especially patients, don't know about this program. And so that's problem number one, I think. And so when we talk about what we should be advocating for as organizations, as advocates, as a community, we want transparency, not only in that this program exists, because when you walk into a hospital, there's no sign that says this is a 340B hospital. And there's no sticker on your drugs when you pick them up from the pharmacy that says this was a 340B drug and purchased at a discount. So we want transparency about the program so people know about it so that they can ask questions to both of your points, but also transparency around how those discounts are being used, where those dollars are going once the entities save them. And then we want to also advocate for accountability. So not only do we want to know where the dollars are going, but we want to hold all the entities accountable for how they're using them. So we really want to make sure that we can prevent these misuses, that those dollars can go to patients like you guys who need them to access the care that we all deserve, and ensure that those savings directly support the patient care and affordability. Both are very important. And again, that patient-centered protection. So safeguarding this program to be a true safety net program that we're providers while we close these loopholes so that we can allow the profits to go to the patients only and not be diverted and used as profit, as we've been highlighting here, happens in some instances. And Dominique, I'll hand it back.
Thank you, Lizzie. So some of our concerns, and this is just some of them, you've already heard the stories from these amazing ladies. So we just want to kind of highlight some of the most prominent things that we can talk about in this short amount of time we have together. So limited patient benefits. Patients may not always see reduced costs for their medications, even though the 340B provider purchase at a discount. Increased cost of care when entities profit from the difference between 340B discounts and higher reimbursements. Patients may not see the savings, and overall healthcare costs can rise, undermining the program's intent to improve affordability. Focus on profitable patients. Some providers prioritize serving insured patients who generate higher profits rather than focusing on the underserved populations the program was intended to support. We know why this is a big struggle, especially in rural areas and things like that. When you see this, you see a lot of patients who suffer at the cost of people getting higher paychecks and building new fancier hospitals as opposed to what it was intended for. Movement of the 340B entities to affluent areas. Rather than expanding the access in underserved communities as intended, the 340B hospitals and pharmacies have opened sites in wealthier areas, which is kind of what I was just talking about, where insured patients are more common to generate greater profits. Again, we want patients over profits. Lack of transparency. It's not always clear how the savings from the 340B program are being used or if they are benefiting patients in need. There are no requirements for contract pharmacies to share any of the 340B savings with patients. We know why this is so important because the whole point is to put the patient first. Hospital consolidation. 340B can incentivize hospitals to acquire smaller providers, including independent cancer clinics, fueling consolidation that drive up patient costs and shift resources away from the communities in need. Again, we want patients over profits. Protecting community access. Advocate by sharing your story with your community, sharing patient stories, sending letters to legislators, talking with legislators, demanding patients receive the benefits of the program. This is just some of the ways, but we are big on using our voices. We know that we are better together. So educating our communities, empowering them to share their stories, empowering them to ask questions, empowering them when they go to the doctor to say, hey, what's my medication really cost? And we know that when we do this, that it leads to better outcomes for our patients. As you've heard the lady say, like once they were empowered, they were educated, they knew to ask questions and it benefited them.
Absolutely. And these are ways we can all engage in this. And now we're inviting you to do this with Tiger Lily and Koji. And we want to make it as easy for you as possible to engage in advocacy around protecting the 340B program as it was intended to work. So together we've created this advocacy toolkit that we will be sending out to everybody and will be available to you all. You can see a list of the items that are included in this, but we want to highlight these are all editable and produced to be kind of a plug and play. So you can put in your organization name, your patient population. You know, we're all working in different ways, but all of our patients are touched by and should be supported by the 340B program. And so that list that Dominique just went over, we legislator meetings, meeting with your legislators at the state level and the federal level. We've put together some talking points that you can use that illuminate, the intent of the program, the current misuses, the patient impact. We have versions that are for a patient advocacy organization and for individual patient advocates to use. And again, very easy. You can put in your own information and easily tailor it for who you're advocating on behalf of. And also has prompts on like pieces to share about access issues from your patient populations or that you've experienced as a patient yourself. And then template comment letters. We have comment letters that you can send to your offices. So if you're not calling and speaking to them or having meetings with them, you can send a letter just as easily. And we have both of these again for an advocacy organization or for advocates individually. Same thing, tailorable. You put in your information, your patient population, the points that resonate with you and your patient population the most. And we also have a list of resources that we'll be going over after this that where you can pull the data specifically and easily about the state that you're in if you're doing this at the state level to put in that specific information in these templates. So we've tried to make it as easy as possible. We also have tips on writing op-eds about this. So if you want to, as an organization, write an op-ed or work with one of your patients that you serve in getting an op-ed, we have some tips on how to do that on 340B, as well as patient blogs and letters to the editor. It's, as you've heard us talk about, and both of our amazing patient experts talk about, it's so important that the community knows about this, not only policymakers and lawmakers, but our community and patient networks as well. And then we have two documents that you can use and reference. So some 340B fast facts, and then a little summary of the 340B program and why patients should care. And we're happy as well to provide editable versions of those if you would like to use them or update them for your patient populations and put your logos on them. Those will be available to you. And we have a social media toolkit that will be coming around in our follow-up for you all as well. So again, our call for everyone to join us in this advocacy work, we're trying to give some of the tools to make it easy, and we're happy to help both Koji and Tiger Lily with any of these as well. So before we move on to our next piece and some of the resources and links that we have for you, we would very much appreciate if you would take the poll. It should have just popped up on your screen. It's only 4 questions. It should go pretty quickly. And if you could respond there for us, we'll wait just a minute for everyone to have a chance, and then we'll pop back in. And while everyone's filling these out, we'll have a Q&A here in a second. So if you have any questions, we ask that you use that Q&A box in the bar in your Zoom toolbar, and we will be addressing those in a second. And please feel free to use the chat too to connect or add comments there. Okay, we will leave the poll up, so please complete that, and we'll continue on in hopes of meeting everyone and wrapping up on time today. I'll hand this back over to Dominique.
So as Lizzie said, we wanted to give you guys as much information, as much education on this as possible. We want to support you in any way that we can. Some of the resource links that we have is the National Black Caucus of State Legislators 340B resolution. We have Pioneer Institute, ASAP 340B, Alliance for Integrity and Reform 340B, Pharma State by State Stats, Tiger Lily Foundation 340B webpage. Those are just some resources for you to use. We want to empower you with as much stuff in your toolbox as possible. Even with the toolkit, we are working hard to support you. So if there's any questions, anything that you guys feel that you need, feel free to reach out to us, because that is why we are here today, to help support this great mission.
And I'll just add Pioneer Institute, Alliance for Integrity and Reform 340B, and Pharma State by State Stats all have the state-specific statistics for the misuse of the 340B, the dollars, and all those things. So these will be sent out as well for you. And I'll pass it back over to you, Dominique.
And last but certainly not least, we want to thank our wonderful sponsor, Amgen, because that is the reason why we are able to do the hard work that we are doing here to support you guys. So thank you, thank you, thank you. On behalf of Lizzie and I and Tiger Lily and Koji, we thank you, Amgen. And now we are at the Q&A portion. If you have questions, you can drop them in the chat. I'm going to read some of the things from the chat as far back as I can see. Appreciate the words, work, and perspective shared today. Great to see such a strong panel of women leading this conversation. Thank you, thank you, thank you. We truly appreciate it. Someone asked, I was late joining. Will we receive a copy of the recording? Yes, you will receive a recap email with this.
Yes, we'll follow up with everyone after and provide the link to the recording, all the toolkit and resource links, and we'll also have a newsletter going out at the end of the month with all that information, as well as some additional resources and updates for everyone. And I did get a question in here about what are some good first steps that advocacy organizations or patients can take to start advocating for 340B. So I'll open that up if anyone would like to respond to that. I'll jump in after.
So I think good first steps is one, using this toolkit. There, the fast facts, educating your community, educating yourself on it, finding out if the hospital that you currently use is a 340B hospitals, knowing where your state stands on 340B hospitals, um, and just using your voice, sharing your story, writing those letters to your legislators, not just on the state level, federal, um, all of those things. Lizzie, I guess I can pass it to you.
Sure. Yeah. Or DeAndrea Garina, from the advocate perspective, what would you say are great first steps? Easy, maybe the least scary, because you both jumped into something that can be complex.
I would say just do your research. Do your research. Even there is a website that you can go to that has a lot more resources and information regarding the 340B program. Reach out to your legislators. Reach out to just look at your legislators website and just see what information is out there regarding the 340B, new bills, old bills, or information. Just gather as much resources and information as you possibly can. And if you feel that this is something that you would like to jump into and become a part of and advocate for your district, your region, by please jump in, and advocate for yourself as well. If you are receiving drug coverage and you feel that your drugs are, too expensive, or you have seen a significant jump from paying little to no money to a lot, definitely advocate for yourself. You are your own advocate. You are the best advocate for yourself. So let your voice be heard. Don't be afraid to express how you feel about things concerning your life, because it's your life and you have to live it, and especially with the drugs and the costs and everything that continues to rise. So be your own advocate, and then take that information that you learn by advocating for yourself into the community and advocate for other people.
Yeah, I totally agree with that. And would also add that you've already done the first step by knowing your story. And sometimes it feels like your story is the only one, but there are so many other people out there like you. So you tell your story, help somebody else. The next thing is get connected to an organization. If you're not sure about how to research on your own, get connected to an organization like the Two Here, and that provides education for your issue, for this type of advocacy, and they will help you and help you work on how to tell your story. And the low lift thing, like that, a lot of people can do, is write the letter, because the letter is that for me, the letter was the first point where I was like, okay, like I got a response from the office, like they listened. And that was like, oh, well, now I want to go and advocate on the Hill. Well, now I want to talk about this more publicly. Now everyone should know that this is an issue. And so you don't have to do everything at once, but if you choose to do one thing and then are confident and know your story, you've already taken the first step.
All of that. Yes, so important. And I would just add, I agree with everything everybody said, and so I don't want to repeat, but I would add from the advocacy organization standpoint and the individual advocate standpoint as well. We kind of talk about it like advocate beware, but really, when you hear about 340B policy work, dive in a little bit. To Karina's point, do your research. Something that we're seeing and we really want to be cognizant about is the language that's being used around this at the state level and the federal level. And the bills that are being introduced are very misleading because they have names like protect the 340B program or protect patient access to 340B program. And when you go in and read, it's actually protecting the expansion of contract pharmacies, which is where we know a big issue is, or the expansion of PBM involvement, which we know is a big issue. And so I would just add that just because a bill or something has the word 340B program in it doesn't mean it's actually looking at serving the patient. So keeping that lens of like patient impact and everything that you look through that. And like Dominique said, our organizations are here to help in any way we can as well. And helping in deciphering any of that. But if it's not a bill that's saying the funds have to be used or reinvested in some way that benefits patients, it's not a bill that's actually protecting the 340B program. So that would be my addition to that. And I see Mayma, you came back on, so I didn't know if you wanted to answer this too.
Yeah, well, I want to say that policy is really can be scary, but your voice is so powerful. When I began this journey, I was 31 years old, a single mom. I had no idea about policy and bills and state and federal. Um, but I met some incredible people that taught me that my voice matters. And when I first got out there to speak, I was terrified. I was so scared. But when I spoke, people were like, this is really your experience. Are there others like you? And that me sharing my one story began a movement that now has reached millions of women across the nation and spark other policy work. So I would say just realize that there's a gift that only you have and a power that only you have to share. That's your story. So know the facts, but share your story. Don't be shy. People's lives depend on what you have to say and what you're saying often and repeatedly. So know the facts, show up, stand up, and don't be quiet about this. And you'll learn looking back in time that you're going to save lives and make an impact. So just keep doing what you're doing. I'm so proud of you both for being advocates, and I'm proud of Koji and all you're doing as a partner, and look forward to people learning about 340B and speaking up and making this policy is really amazing policy. It really is meant for good, but it's being misused. So let's get it to be used for the right things to help people have better quality of life and longer life as well. So keep being amazing women, and I'm really proud to know all of you.
Thank you, Mayma. I think we'll have one last question asking why aren't hospitals being prosecuted for fraud? Which, like, 100%. That's a great question. And as we shared at the beginning, I'll jump in unless anybody else wants to, but the the federal bill, the law that created the 340B program is very vague. It doesn't require any of these reportings. And so one of the great things, I think it's on the pharma resource link that we had up, you can see state by state how many audits have happened in the state since 2025. That's very few because they're not required. And like at least almost half of them in every state show some kind of illegal use of 340B funds. But because it doesn't have these safeguards in place and it's not spelled out, right now, that's why we can't do anything about it. And that's why we're advocating for this. So that's why another reason this is so important that we all engage in this. There have been lawsuits at the federal level between some of the manufacturers and um, entities about how they're using the discounts because some of the manufacturers have said, we're not going to give you the discounts if you're not using them the way you're supposed to. And then the entities have said you're not allowed to do that. And so there's some lawsuits ongoing there as well. So we're trying, and so are manufacturers because they're the ones providing the discounts. But that's just another reason why this work is so important. And I'll pause and if anyone wants to add anything there. Okay, well, if anyone has any other questions, I think we got through them all, but if you want to drop them in the Q&A or in the chat, we're happy to address them in our follow-up. If we didn't get to them right now, you can always email us as well. We can drop our emails in the chat for everyone to access. And just really quickly want to give our amazing panelists a chance if you have any closing words to send us out, and then Mima, I'll have you do the last. Well, sir, DeAndre, is there anything you'd like to say?
Well, I just wanted to say thank you all for the opportunity, for the great questions in the chat, for sharing your stories, and just leave everyone with the reminder that community is everything. Healing happens in community, and your voice is necessary. The more you may feel like it's insignificant or that it's not polished or that it's not the best thing to say, but we need your voice and we need your contributions to continue this advocacy.
Karina?
Yes, I just would like to say thank you to both organizations, always coming together to educate the community and make us aware of a lot of things, especially the 340B program, which is something that I continue to do my research on, that I continue to want to be a major advocate for, not just for myself, but for others that feel that their voice is not. Cannot be heard, or they are afraid to speak out. A lot of people are afraid to speak out because they feel that the doctors and the pharmacies are the ones with the education and the skills, and so it's kind of intimidating a little bit. But don't be intimidated by titles, by these big corporations. Don't be intimidated. Let your voice be heard. Share your story. When I started this, I knew that it was something in me that I wanted to tell my story. I was never afraid of my story. I was never ashamed of having breast cancer, because I knew that there was a greater purpose for me to even get breast cancer. Being healthy and being young and I worked out, so it wasn't something that I just sat around and just, oh, okay, I'm gonna just, okay, I have cancer. And I just allowed it to take over my life. No, I did not. I didn't allow it to take over or make me ashamed or scared about my journey. No, it empowered me. And not only does it empower me, but when I speak or I tell people my story, it empowers so many other women as well and other people as well. So that is what I want to continue to do. And being a part of Tiger Lily has awarded me that benefit to be able to do that. So let your voice be heard and continue to advocate and fight.
Thank you. Melody and Dominique?
I'll just say,
You're on the
like,
spot, Mel.
I'll go first, and I'll let Melody go because I know she's gonna drop the mic on us. So I'll just say thank you all, ladies. Somebody said in the chat, like, it is amazing to see a group of women push this forward to educate communities. So thank you, ladies. And to everybody watching, just know that your voice is powerful. We are better together, and each time that we use our voice, we bring change. It may be a little bit at a time, but we are moving things. So thank you guys for joining us today.
So I would like to come in and say that I'm incredibly proud of every woman who has participated in this 340B Education and Awareness Initiative. I believe that in these communities that we serve, it's often thought that there's nothing that we can do. And through both DeAndre and Garina's story and all the stories between the six of us, this shows advocacy in motion, empowerment, and the need to be connected to community, the need to have the education and insight so that you can understand what you can actually do, and that progress and purpose is amongst us. And if we continue to lead these endeavors for our care, we can turn the needle. It doesn't always, I'm sorry, we can move the needle. It doesn't always move swiftly, but inevitably it will move because we're in community and doing it together. One person can go fast, but a group can go far.
Okay, take us home, Mima.
How do I follow that? Can I just say what she said? Like what she said, mic drop? I would just say my heart's very full. This 20th year being a survivor is really, really like my heart's just full reflecting on where I've come from and what I built and what you've all built and who I've learned and met along the way. Knowing, Melanie, you and Dominique and DeAndre and, Karina, Lizzie, everybody, it's been an incredible journey. Um, I began this work as a young woman who had no idea about policy, no idea about advocacy, no idea about any of it. My one commitment was to love women, to share that love, and to use my voice to make sure others had a better experience than I did. And so to see this work blossom this way as a partnership, to see all of you standing in your power today, sharing your voices is really important. Um, the policy is out there, but you're bigger than the policy. People make up these policies. So when you own your power and step into that power and speak up, we can change this for other people. Um, any woman you touch with this story, any man, any child you're touching, they're seeing your purpose and that purpose moving in faith to make a difference. And so just keep being yourselves, never change, keep growing. That's the only change you're going to make. Keep growing, keep expanding, keep opening your heart to making a difference. And thank you to our sponsors at Amgen. Thank you to Koji and the whole team and all of the angels that have been a part of this work. And for those who have been listening to this webinar, please rewatch it, please share, and let's keep changing the world to make it better for people who are living with breast cancer and other cancers as well, to have a better experience, a better quality of life, and longer life. Thank you.
Thank you so much. This concludes our webinar. Thanks for joining us, and keep an eye out for our follow-up emails. Take care,
Thank you.
everyone.